welcome everyone to what has grandly been called Frontiers in Buddhist Chaplaincy, the first annual New Scholar Practitioner Symposium at University of the West. At the end, we should probably dedicate the merit to make sure there's a second annual symposium for New Scholar Practitioners. So welcome and thank you for coming. My name is Monica Sanford. Most of you know me. So I completed my Master's of Divinity in Buddhist Chaplaincy here at UWest last year, and I'm now a student in the doctoral program at Claremont School of Theology, studying practical theology as a Buddhist, such as it is. So I am very pleased to present some of the alumni and students of University of the West, Claremont School of Theology, and the Academy of Jewish Religion, all of whom are studying chaplaincy. And I think it's very wonderful and appropriate that we are having this little gathering today in Kenlock Hall. So for some of you who don't know why that's so fabulous, I just want to say a couple of quick words. Dr. Kenneth Locke was the chair of the Religious Studies Department here at University of the West when the Divinity program was established. So it is because of him that this university is graduating chaplains and sending them out into the world. He brought Reverend Dr. Danny Fisher, who's hiding in the back row here, several years ago to start the program and run it and help us get wonderful educations so that we can now come back and share what we've learned with you. And just on behalf of the alumni of the program, several of whom are here today, I just want to remember Dr. Locke, and also, since this is his last year with the program, give a very deep bow to our teacher, Reverend Fisher. So thank you so much. So I'm going to introduce the presenters. We're going to have 5 presentations total. Our first 2 presenters are hospital chaplains who are out there working in the world of hospital chaplaincy right now. One of them is a graduate of this program, and another is a colleague of mine at Claremont School of Theology in the Practical Theology program. They're going to give their presentations, and then after that, they'll be able to take questions. And since we're such a small and lovely and informal group, I'm going to leave it up to the presenters if they want to take questions and have a conversation with you guys during their presentation. That's totally up to them, and I hope we can actually do that. Then we're going to have a small break and transition, and we're going to have our panel on military chaplaincy. And I'm very happy to say we have not just 2, but 3 military chaplains, actively serving military chaplains here with us today. 2 of them are in plain sight, and the 3rd is hiding in camouflage in his robes. But we're going to drag him up here to be on our panel for military chaplaincy. Following that, we'll take another short break, and then Michael Salonius from the Academy of Jewish Religion will present, and you're welcome to come sit here in the front with the rest of us. And then I'm going to round it out by talking about where chaplaincy is going in the academy, and basically being a chaplain in the Ivory Tower. Then with no further ado, I'd like to introduce Holly Hisamoto. Holly graduated from the program here at University of the West last year in 2013, and she has been doing her residency, her CPE residency, full-time at a hospital in Portland. So Holly, welcome.
Hello. So, my name is Holly Hisamoto. Just a few words of thanks to everyone who organized this event, to all of our teachers, academic and spiritual, and to all of those of you who are interested in this topic. May what we learn here today be used to benefit beings, in whatever our professional paths may be. I'm a graduate of the program. I graduated last May, and I'm currently doing a CPE residency, or year-long training in a hospital in Portland, Oregon. And Monica asked me to come and say a few words to all of you. And so I was thinking about what was the most important thing I learned this last year being out of school. And I kind of framed it knowing that Monica is going to conclude this with a discussion about the academy and interesting new frontiers in Buddhist chaplaincy in the academy. I thought about what I want to share with you is really experience on the ground. So when I was in school, I thought a lot about being a Buddhist chaplain. And now the most satisfying work is practicing being a Buddhist chaplain. So I wanted to share with you a taste of what that actually feels like to be a Buddhist chaplain. So I'm going to do that by providing some lived responses to these 4 points. So the first is, what is chaplaincy? So my hope is to offer you some kind of holistic, embodied experience of the actual nature of this work. So what does it feel like to be a chaplain? What kinds of human experiences are we talking about in this line of work? And I'll do this by depicting a day in the life of my hospital chaplaincy. So patient visits and my schedule and things like that. I'll also address what is Buddhist chaplaincy. So I feel like that will look different for all of us, but for me, it's been using chaplaincy as a Buddhist practice. So I'm coming from a Vajrayana perspective, and the material here kind of assumes you have some familiarity with Mahayana terms and aspirations. And if you don't, feel free to Google amongst yourselves. But I just want to share with you a model of what chaplaincy can look like from a Buddhist perspective that you might be able to take and make your own. The third part, what practical theology can look like in Buddhist chaplaincy. And again, rather than talking about this, I'll just demonstrate the way that my religious views and practices feed into my work, and the way that those experiences at work hold me accountable to, challenge, and help me explore my religious beliefs and practices. And then finally, reflections on frontiers in Buddhist chaplaincy. So a little bit of context about the hospital. So I work at Legacy Emmanuel Medical Center, which has an adult hospital, several hundred beds, a children's hospital, several hundred beds, a burn center, and emergency department for level 1 trauma, as well as psychiatric treatment. So very diverse medical needs, and for the most part, patients identify as Protestant, Christian, different denominations, or Roman Catholic, or this kind of unique Northwest version of agnosticism, which is spiritual but not religious. So that's the patient population in terms of faith backgrounds. So, with that, let's begin our day as a Buddhist chaplain. So, the first thing I do is notice my body, sensations, preferences, attachments, aversions, neutrality, numbness, thoughts, images. So as you move through this day with me, I invite you to do these contemplations for yourself. And I'll pause on certain images throughout the day, and you can look at yourself and notice what comes up for you in response to these situations. I don't want this to be traumatic, so the intention is for it to be immersive, but if anything here is very disturbing for you, please take care of yourself. So you can look away, you can step out of the room if you need to, bring to mind something calming or relaxing to take care of yourself. And all of these images are not actually of the patients that I work with. These are all anonymous. And all of the patient information has been changed dramatically to protect privacy. So, It's 4 a.m. I'm sleeping in the hospital overnight room. Well, barely sleeping. My pager goes off. It says there is a #1 trauma in the emergency department. I have 15 minutes before I need to arrive. I have time to do my morning prayers, one of which includes, I have offered my body to the Buddha, Dharma, and Sangha. May I be a guard for those who are protectorless, a guide for those who journey on the road. For those who wish to go across the water, may I be a boat, a raft, a bridge. I put on my clothes and walk to the ED. This mundane moment, feeling groggy, irritated, uncertain of what I'm walking into, this is a familiar barrier for me in caregiving during crisis. Who knows what is on the other side of this long hallway? I watch my own resistance and fear, worries over my not being competent, over what will be needed, over the outcome. It occurs to me suddenly, I have already offered my body to this exact moment. What did I think when I was taking my bodhisattva vows? That people would only require my support when it was convenient for me? This one moment in the hospital suddenly seems so small, given my commitment to lifetimes of devoted activity. What else was I signing up for, if not a direct encounter with reality? So a deep breath here. I arrive at the emergency department and watch people crowd into a small room, surrounding a woman on a patient table. People are frantically doing chest compressions on her body, and others yell orders for an MRI machine and medications to be delivered. There is so much movement, busyness, and adrenaline. I stand there and take it all in. The social worker is gone at this hour of night, and normally I would connect with him for the backstory and patient information. I can tell the situation is desperate from the pitch of voices and the speed of hands. I feel helpless and watch others deal with feeling helpless. Some staff members make crude jokes. Others bite their lips or wring their hands, busying themselves with unnecessary paperwork or second-guessing second guesses. I learned that there was a motor vehicle accident, a gay married couple, 2 women in the car, 1 badly injured. I make remarks about the sadness of the situation and feebly try to offer some sense of solidarity in the mess unfolding before us. With all my clinical and religious training, the real test is right here. What does it mean to offer compassionate action in this moment? I see a woman standing in the far corner of the room, pale and wide-eyed. I introduce myself to her. I'm Maria, she says. I learn that Maria is the patient's spouse. Somehow, it appears she has been ignored in the mayhem of the medical interventions. I feel angry on her behalf, deeply saddened by her shock and isolation, and guilty that I didn't get my butt out of bed earlier. I invite her to a private waiting room where we drink coffee and talk about everything that comes into her awareness: her children, her marriage, her job, vacations, the texture of the horribly uncomfortable chairs where we sit. 1 hour, 2 hours, 3 hours. The doctor finds us, and we're invited into the emergency room to be with her wife during their last moments together. They do not identify as religious, but I ask if there is anything meaningful we can do in these last precious moments. They want to sing a Christian hymn together. I sing along with them as the patient dies. After her wife's death, Maria is speechless and overwhelmed. We enter a strange zone of mundane activity, organizing paperwork, contacting family members. I ask the doctors to clarify obscure medical jargon while she gasps in shock. I wait for her family to come. At times, we fall into an intimate silence. We cry, or we complain. Her family arrives, and I check in several times throughout the day, helping provide funeral arrangements and grief support. When I walk away from the ED, I notice such heaviness in my body. I go to my office and eat oatmeal. I write a chart note absurdly summarizing a 3-hour emotional marathon with simple, dry clinical phrases such as anticipatory grief or bereavement support. I feel scattered and distracted, eating too much without paying attention to the taste, reviewing emails without comprehension, ruminating, did I say enough? Did I say too much? I obsessively think about what I can do to challenge potential institutional homophobia in the situation. Angry and sad, images of the morning flash and lurk. The mind is restless. It's cues. It's these kinds of inner messages that are so obvious. I need to refuel. I need spiritual renewal. I need to practice. I do my personal sadhana in my office, in particular focus on the following. Ultimately, everything is empty. Eventually, may I manage to surrender everything I have for the sake of all beings. For me, these practices, the remembrance of emptiness, brings about relief, a sense of fresh air, open space, and possibilities. There is room for everything, and no need to fixate or cling. I can cry, I can be angry, death can happen. I also feel love and beauty in music. I bring to mind my deepest aspiration to benefit beings, naturally including myself. I feel energized in my reconnection to the ocean of Dharma. I watch the sunrise from my office window. May I be a boat, a raft, a bridge. I begin making random patient visits. I go to nurses and ask which patients might benefit from spiritual care. Most of my day will be these random visits, following up with those I or my colleagues have already seen, or those who requested chaplain support. I often think of this work as hearing the cries of the world, attending to the needs of sentient beings and the diverse number of ways suffering manifests. I meet one young teenage girl here for an eating disorder. She is unusually articulate and self-aware and wants to improve her family relationships. She tells me she is a strong Christian. She's trying to discover what she believes and values. She believes strongly that everyone has the divine in them, the Christ-like nature, she says. I ask her how this interacts with her sense of self-worth. This prompts a lengthy discussion on the contradictions between our deepest values and our behavior, especially as this manifests in harming ourselves. She has several significant insights and concludes, if Christ isn't everyone, then why am I hurting other people and myself? What a good question. During the visit, I was very concentrated on the patient. In a relative way, I acted as the therapeutic guide. Circumstantially and professionally, I was the spiritual caregiver. But afterward, her experience really guides me. After the visit, I felt challenged to reflect on my own sense of Buddha nature, the basis of my own self-esteem, my own history in hurting myself. How can I improve my relationships to my family? The patients are such good spiritual teachers. I meet an older man. He is deeply depressed after a traumatic burn to the lower half of his body. He also struggles with estrangement from his children and job loss. He tells me with anger that he wants religious answers, damn it. We talk about the book of Job. He recounts the absurd misery of accumulated losses and relates to the despair and outrage expressed in this story. I often feel like we're talking in circles, no meaningful answers in sight. But at the end of the visit, he asks if I can return tomorrow on the Sabbath. I ask if he wants me to bring a prayer book or anything else. He says no. Just good company at the right time is enough. I see that relationship is an answer to despair. It's getting toward the end of my shift. I went back to the emergency department and asked people about the homophobia thing. I talked to a few nurses and doctors who were recovering from the event in the ED this morning. Overall, I feel tired, but also illuminated and humbled. Toward the end of my shift, a family in labor and delivery requests a blessing for their infant baby girl. I arrive in their room and am struck by the happiness of the scene. Stuffed animals everywhere, photos of family, a golden glow of the sunset coming through the window. I sense hope and optimism from the parents. I ask them what they want for their daughter. The dad tells me about all the things he wants to show her of the world. Family dogs, riding a bicycle, the flavor of ice cream, playing in snow. They are Catholic, and they ask me if I'm Catholic. I say no, and they seem disappointed. The conversation suddenly stops. There is a long, awkward pause. I still struggle to articulate my theological perspective on interfaith care when faced with situations like this. I have so many strong feelings and values, but I'm used to trying to articulate those in an academic setting. I almost begin a heady intellectual discussion on the topic of pluralism. But the mother, blessed be, suddenly decides that she wants me to bless the baby after all. She says affectionately, "We don't believe what you believe, but we respect that you believe in something and are made better through that." I smile in relief at her greater wisdom. I bless their daughter and return to my office for the day. Again tired, humbled, but satisfied. So, at the end of the day, I usually return to my office. And there's usually other chaplains there that I get to talk to you about experiences that I've had. And I often think of it like if I were to shake all the experiences I had during the day and questions were to plop out. These are the questions that become kind of theological questions. So these are the questions that I'm bringing to you at the end of this day. And when I thought about the word frontier for New Frontiers in Buddhist Chaplaincy, I was thinking about, well, first of all, some of the problems I have with the word in terms of like colonialism and pioneering spirit and things like that. But when I was thinking about the word, there's this boundary, this idea of boundaries, this idea of borderlines, borderlands, this sense of the limit of something, and also this quality of the unexplored and maybe a sense of adventure. And so these are questions that for me come up often as the places where there are borders in my work, the places where there are maybe limits, the places where I have a sense sometimes of fear and also of excitement in the unexpected. So the questions are, in this new frontier of being chaplain and Buddhist, what does chaplaincy contribute to Buddhist practice? So this comes out of so much of my work. The being with suffering, being with other human beings in the way that I do, helps me see what refuge means, helps me understand what my vows actually mean. When I put my body in these situations, I see how seriously I took those vows or not. What does Buddhist practice contribute to chaplaincy? I often thought of that in the academy as how are Buddhists going to change the profession? How are we going to change the dialogue? How are we going to advocate for ourselves? And I think those conversations are important. But I'm now seeing the way that my practice actually allows me to be a chaplain, the way that it is the ground from which all of my energy for the day comes. It's also something I offer to patients. The ability to be in silence together, the ability to know myself clearly, different assessments that can be created from my own practice, incredibly useful in everyday moments. What does Buddhist chaplaincy mean to you? This is also a question that maybe I didn't ask myself as seriously when I was in school, but rather than thinking about what should Buddhist chaplaincy be as some sort of monolithic thing, I'm now seeing that I am creating an organic Buddhist chaplaincy for myself based on my own experiences, my own developing, my own religious formation, my own professional developments, and patient experiences. And so I encourage you to hold that question for yourself. What does Buddhist chaplaincy mean to you? How important is a Buddhist identity in your chaplaincy? Sometimes for me, not so important. Other times, I see the value of naming it. I see limitations in other people naming it. So why is it important? And also, how does this identity manifest in interfaith caregiving? I think, again, I'm interested in that question intellectually. I'm even more interested in that question in the face of a family who wants me to bless their little girl. How do you understand and respond to conflicts in being a Buddhist and a chaplain? This question came up this morning in class about how I work with feeling rejected, which unfortunately does happen. Oh, you're a Buddhist, please get out. Oh, you're a Buddhist, the conversation ends. And how do I deal with conflicts in my experience in the curriculum, the education curriculum, when people ask me, what is your image of God? And I don't have one. Or ways that I'm invited to participate as a chaplain that for me feels slightly proselytizing. So there are all these manifestations of conflict that, don't need to be answered maybe, but need to be negotiated in practice. So at the very end of the day, I dedicate the merit. And I call this, by the way, the hospital mudra. So the many ways that we hold hands with people. Which, by the way, I always thought of like hand holding as kind of a derogatory term, like, oh, you're just hand holding. But my gosh, there's something about when people are so raw and alone, just sitting down and having some sort of non-invasive, non-medical touch. And just saying, I'm here to listen. So important. I know that as a consumer of spiritual care and as a caregiver. So if you'll join me in a dedication. I dedicate whatever virtue results from my actions to all sentient beings. And now, as long as space endures, as long as there are beings to be found, may I continue likewise to remain, to help dispel the miseries of this world. Thank you. And thanks to all these peeps who helped me train.